Hello, my name is Dr. April Armstrong. I'm Professor of Dermatology and Associate Dean for Clinical Research at the University of Southern California in Los Angeles. My topic today was IL-17 blockers, and we covered secukinumab, ixekizumab, brodalumab, which are all FDA approved for psoriasis, and in addition to that, I also covered briefly bimekizumab, which is an upcoming IL-17 blocker. What we know as a class for IL-17 blockers is that they have robust efficacy in the skin and also in peripheral joints, as well as axial manifestations of psoriatic arthritis. When we're looking at skin in adults, what we can see in terms of IL-17 blockers for secukinumab, ixekizumab, and brodalumab, our FDA-approved agents, is that they have very good long-term persistence if you were a responder in the first place. So now we have really multiple years of data showing that it works well over time in adults in terms of clearing psoriasis in the skin. With regards to peripheral psoriatic arthritis, so our psoriatic arthritis affecting our peripheral joints, such as the hands, what we know is that secukinumab and ixekizumab work just as well as adalimumab in terms of treating the peripheral arthritis. So the old adage that TNF inhibitors may work better than IL-17 blockers have really been debunked by these head-to-head studies. In addition to that, what we also note is that secukinumab, they published their first trial in terms of looking at the effect of secukinumab on axial manifestations of psoriatic arthritis, and it has been shown to be effective to treat spine disease as well, with regards to showing an IL-17 inhibitor effective in that particular domain of psoriatic arthritis. Overall, what we also see is that for IL-17 inhibitors, some of them have been tried in terms of HS, hidradenitis suppurativa, and we have really promising results that we see early with regards to some of the IL-17 inhibitors in terms of treating HS. So we may have another promising option for HS patients other than adalimumab, for example, which is the only FDA-approved medication currently for hidradenitis suppurativa. And finally, we have an emerging agent, bimekizumab, which is an IL-17 A and F inhibitor. And bimekizumab has highly robust efficacy in terms of the skin. And we're also seeing the joint data in addition to that as well. So I would say overall, the landscape for IL-17 inhibitors is quite promising. So one thing we do need to recognize is that we want to avoid IL-17 inhibitors in those with a history of inflammatory bowel disease. And also there is low rates of mucocutaneous candidiasis. Those can typically be treated quite easily with fluconazole, for example, if you want to go with oral therapies, 100 to 200 milligrams times 7 days. So overall, I think IL-17 inhibitor class continue to be a highly efficacious class for our patients with psoriasis as well as psoriatic arthritis. Thank you.